April 11 presentation for the Center for Music Education at Georgia College. Today we're talking about vocal health for music educators with Dr. Sowell, and Dr. Sowell is a professor of music at Valdosta State University. He's a Georgia College graduate, and he worked with us at Georgia College here a few years ago, and so we're really excited to have him back. All right, welcome.
Thank you so much. So I wanted to do this presentation because often I have gotten requests from teachers and they're from choir teachers, orchestra, and band, and they all come to me and they say, I feel like my voice gives out, particularly in that first few years of teaching, and they don't know what to do about their voice. And it got me thinking, well, this is my livelihood. I spend my whole day thinking about my voice. We don't all do that. And so what are some things that we can think about as educators to protect our voices, which are apparently just our most valuable asset as a teacher? So this presentation is going to be interactive, hopefully, and have you do various things and exercises that you can find that will help better your own voice for the longevity of your teaching career. So the first question is, why does it even matter? Um, this idea of vocal health, because I think we often take our voices for granted. They're part of us. We exist. We generally talk. Why does it even matter? Well, research says that teachers are reported as the largest group of professional voice users. I mean, and truly, if you think about how often you speak in your day, it's probably quite a bit. And you start so early in the morning and you go late at night. And you also have to think that as a music educator, especially as a band director, I don't envy y'all who have to speak over instruments even. As a choir teacher, I've taught over singing students, and that's a whole different animal. So there's actually was a study about university professors, and it found that 45 out of the 100 university professors, they all reported a vocal disorder at some point in their career. And we can talk about what different vocal disorders are, because I think often we think a vocal disorder is a polyp or a node or a growth. And actually, it can be just as simple as you have laryngitis. I mean, there's a whole spectrum of vocal disorders. 6.7% out of that 45% said it lasted longer than 4 weeks, which is a pretty significant um, length of time for a vocal disorder. In that research, while it was about university professors, she actually noted that that level of 45% and 6.7% was much lower than it was for the K-12 teachers that she interviewed. And that's pretty significant. We are also models as professional musicians for our students. So the way that we take care of our voices also has to relay to our students as, I am doing this with my voice. This is the way I talk. This is the way I'm taking care of myself. Do you see I'm drinking water? Have you seen me warm up for the day? Do you hear me taking a rest while there's noise happening? We're being a model for our students, even when we don't even realize we're being a model. There is a vocal handicap index out here. And I would actually be curious from both Dr. Davis and Tori, who's on the call. I want you to think about this for yourself, and you can write it down, and I may ask y'all about it, how you're feeling. But with the vocal handicap index, these are some sample statements in it. There's a few more. I just pulled the ones that I thought would be pretty relevant for most teachers. And how you would answer them is a scale of 0 to 4, 0 being never, and then almost never, sometimes, almost always, always. And I think I want y'all to just take a few minutes and look through these 6 statements and write down how, if you feel any type of way about any of these 6. So just take a couple of minutes or a minute and see how y'all feel. And then we'll reconvene. For Tori and Dr. Holmes Davis, was there any one of these in particular that stuck out to you as something maybe you've struggled with or you've seen colleagues struggle with?
I don't have one on this list, but as
Hmm.
a band director, I found that I had to teach with a microphone because, teaching 6 periods a day, like you said, over the band,
Hmm.
especially during pollen season, would wear my voice out.
I know I'm struggling with it. I have a recital tomorrow, and I've just been taking so much medicine lately.
I I feel like all of these I've experienced, some more than others.
Hmm.
Um, I know I last week I was recovering from COVID,
Oh,
and so
wow.
I found that I ran out of air a lot. I was like, really short of breath.
Hmm.
But I say the second one with the sound varies.
Hmm.
I like I could start feeling really good throughout the day, and then it sounds, hoarser in the middle of the day, but then it comes back. So
Hmm.
yeah.
And that's something, and thank you for bringing that up, and thank y'all for sharing. The voice is the body. So the voice at it of itself, it just is going to react to how your body reacts during the day as well. And we're going to talk about different ways that the voice has impacted in various things. And also, I guess I should clarify that I'm not a doctor, so I'm not diagnosing anybody with anything. These are things to bring awareness to your own voice and your own way of interacting with it. So, with that in mind, the idea of these are some of the red flags, if you will, of maybe something's happening with my voice and I should be a little bit more aware of what I'm doing. The next question is, what do we do about it? There are a few things that we can do, and the big research one I want to talk about, actually, there's another talk happening through the National Association of Teachers of Singing today, and I thought, how awesome that we're actually all talking about the same thing at the same time, but theirs is a little bit more specific. So, what is one thing that we can do? They're actually called SOVTEs. It's a pretty popular thing amongst speech language pathologists and voice teachers, and sometimes it doesn't always trickle over into orchestra and band the way that I think it could and it should. So an SOVTE is also called a semi-occluded vocal tract exercise. And that is very fancy talk for simply partially closed voice passage activity. The idea is these exercises are here to cause the vocal folds to slightly close, to build up pressure, to equalize the voice, to create an ease of production. And if I'm ever saying anything that y'all need questions on, I would be happy to answer them. Just interrupt me. Completely fine. What are the physical benefits of these SOVTEs? I'm going to keep calling them that instead of semi-occluded vocal tract exercises, just for that's a lot of words. The physical benefits are it's a reduced vocal load and reduced muscle tension. This is probably the most important reason that I love an SOVT for music educators and for any educator, to be honest. Some of us talk with a pretty increased muscle tension. I do. I actually was diagnosed with muscular tension dysphonia, which is simply this idea that my laryngeal area works excessively through muscle and that the muscles are overly activated. So I'm always having to think a little bit more about reduced vocal load and reduced muscular tension when I speak and even when I sing. And so I went through voice therapy and I found some exercises that worked for me and also exercises that I've done in my own voice lessons. The idea is that if we're going to speak loudly, and often we do have to do that in a classroom for various reasons, we think loud equals heavy or loud. There's like synonyms in this world. Like loud is heavy or it's energized or it's weighty, and that's not the case. Loud should be resonant. Loud should be enriched. Loud should be energized, but through resonance. And so what the SOVT is doing is it's actually taking all the pressure off of the vocal folds that sit like this and move like this in our larynx. And it's actually saying, all right, breath, what if you do the work and let's use our natural resonance? The other thing that a SOVTE does is it aligns your vocal folds. So, and their vocal folds are also called vocal cords. The more modern version is vocal folds, but they're the same thing. Um, this is the reason why they often are aligned is, I mean, they're like any muscle. Sometimes they can get out of sync with each other, and you want them to do a wave when they're vibrating. Often, sometimes when we speak, they get rigid and they can't vibrate and wave the way that they're supposed to. And we want to use the full wave. So the SOVT is actually encouraging a full wave and a fluidity of the vocal folds. Also, it really allows for proper resonance. Resonance, there's various versions of resonance. There's chest resonance, and there's like this sinus resonance that occurs up here. Often singers will say we sing in the mask. It's this idea of existing pretty much from eyebrow to cheeks. And the SOVT kind of forces the voice to start operating in this resonance chamber so that when you are speaking in your class, you're actually relying on a natural amplification versus a forced amplification when we're using too much muscular engagement. Lastly, it also supports the respiratory system, which is important. As all musicians, we know that maybe except strings and percussion, but the others, woodwinds, vocalists, and brass, we know breath is essential to making a sound happen. A proper breathing system allows for proper sound. A proper breathing system allows for proper resonance. And if we have a proper breathing system, the sound is a little bit more effortless. And so the SOVT is also encouraging a support system within the breath to allow the voice to work at its optimal circumstance. So I'm talking about these SOVTEs, but what are they? And truly, we're going to get into more specific SOVTEs, but those exercises are pretty much anything that you want, but I'll talk about some specific ones that I love. So any exercise, any pitch, it doesn't even have to be specific. That's what I love about this, particularly for non-singers, right? We are thinking so much like, does it need to be a fifth? Does it need to be a fourth? Does it need to be an octave? It doesn't matter. It truly doesn't. The idea is just to make sound using these exercises. Do simple exercises. We don't need to make things complicated. Even as a voice teacher, when I'm teaching my students, my exercises are never complicated. I don't see a point because the student has to think about what pitches am I singing, and actually I'm just after make free sound. And that's all you should be concerned about is you're making free sound. So you could choose to do ascending, descending 5-note scales, easy. You could choose to do full octaves if you want, great, love that. Or you could simply do an unpitched siren and just go, and there's no destination. It's just loud, it's low, it's soft, it's whatever you really want it to be. So if you wanted, you could do or non-pitched or non-destination. And I'm just going back and forth. This is a lip buzz, and it actually is an SOVT. So it's great for this. When do you want to do this? 2 important times of the day. Before you ever speak for the day, and at the end of the day. Often we talk about warm-ups, and we're warming up, we're warming up. We have to cool down too. Warming up the voice is very similar to actually like exercising your body. When we exercise, we warm up your muscles so that they're going to be they're flexible and they're nimble and they're ready to take on the giant workout of the day. So if we think the giant workout is you're speaking all day, that is the big old workout. Well, we need to get your muscles properly aligned. These are all muscles and cartilage in here. What we should do at the end of working out, though, is we often do a cool down of our muscles. So some people will do cardio because it's less intense on the like biceps and triceps. And it's really just to get the heart rate going, but actually you're cooling down those muscles that you spend a lot of time working out. It's the same thing we need to do with our muscles, with our voice muscles. And my favorite thing about an SOVTE is you can do it anywhere. There's no specific place. You don't have to be at a piano, especially if you're doing non-destination sounds. Who needs a piano? Nobody. You could do them in your car going to work. You could do or leaving work as your cool down. You could do both. You could do them in the classroom. You could even do them with your students. So if you're a choir director, for instance, your very first lesson of the day or your very first class, you could do SOVT warm-ups with your students and you're doing them with them. And that is a great way to kind of, kill the two birds with one stone thing. As the band or orchestra directors, if you have particular warm-ups for them, then you could probably like sing the warm-ups or lip buzz or whatever the warm-ups, and that you could do that then, or do it before you even teach for the day. Either way would be great. So I will demonstrate some of these on the next slide, and I'll have y'all do them at your own computer, and we'll do them with our mics off just for the sake of like no extra noises happening all at the same time. And then we'll come back and take an assessment. Um, I said that you should always cool down. It just helps refocus the voice and realign the voice after being used all day. Once it's used, we all get like a cramp, right, in the middle of the day. Sometimes that happens, and you're not doing anything wrong. You just get a cramp. I mean, we don't get cramps in the voice, but the idea is still the same that a muscle can just become misaligned. You're not doing anything wrong. We just need to refocus it, right? So what do we do when we get a cramp? We stretch. Same thing with the cool down. We're often trying to stretch. So this is pulled from actually a Journal of Singing article. There's three types of SOVTEs. It's not important that you're doing all three, and it's not even important that you really know like a sustained semi-occlusion, that's not the part that's important. What's important is what I want to show up here are the various examples that you can do, and that they can take different forms. And truly, what I want to advocate for y'all is the SOVTE just needs to be whatever is comfortable for you. There is no right or wrong. It's whatever makes you feel good. I'll talk about the ones I don't do for myself, either because I can't, physically, I just can't, or I just don't like them. Truly, I just don't like them. All three of these are wonderful. All the examples that it says are great. On my next slide, I'm going to pull out the ones that I think work the best and that most students and most people can just do on a regular basis. So these are some types of SOVTEs. The most famous one was made famous by Ingo Tietze, who is a very famous speech language pathologist, and he spends a lot of time talking about speech. He's not a singer at all, but he actually created this idea of straw phonation. I will demonstrate that one in just a little bit, and talk a little bit more about what straw phonation is. The ones that you've probably heard the most are a lip buzz, so just doing just buzzing our lips, just making pitch sounds on it. So for both of you, if you will, I want you to just say, hello, my name is, to yourself. You don't have to turn your mic on. And when you do that, I want you to pay attention to how your voice feels. So just take like 15 seconds to do that. Now, I want you to try out your own lip buzz. So let's just do and take about 15 seconds and do a few lip buzzes on your own terms. So the next one is a raspberry. Keep the idea of the lip buzz in your head and really think about how you felt. If you felt like it was hard or if it was easy or if it was neutral, great. The raspberry, I can't actually do. So it's one I don't do because I really can't do it. I know what it's the thing. I can't do it. So I never do it on my own. But I encourage y'all to demonstrate. It's a great SOVTE because it actually relieves tongue tension as well. So as singers, it's like, yes, the tongue is relaxed too. So if you can do a raspberry, just do it on your own terms for the next 15 seconds. And then again, pay attention to how you feel about the raspberry if you find it easy or difficult, or you're not able to do it at all.
Can you differentiate the lip buzz from the raspberry for us?
Yes. So I'll get closer. So the lip buzz is just the two lips are buzzing together. The raspberry I can't quite do, but it's this idea that the tongue sticks between the lips. And I go,
Oh, thank you.
yes, I'm sorry, I'm not able to demonstrate it as well. That's why I never do them. I can't do them myself, but ooh, some people are great at them. I was not a kid who blew raspberries at people. The next one is actually my favorite. I do it every day. Um, I call it the spaceship sound with my students. Some people also call it a pufferfish. The idea is when you go to lip buzz, the lips really, or the cheeks don't really puff out too much. With the spaceship, you actually kind of want your cheeks to puff out. So the spaceship sound is I tell students when they're having a hard time, if you know what a theremin sounds like, that's why I call it the spaceship. Because if I did it in my falsetto, it kind of sounds like a theremin. Um, so try that out for you and see if how you feel. Take the next 15 seconds and do that on your own and see if you like it or not. The last one, I used the IPA symbol, but it's called hooked in, and all it is the NG sound. Like you're gonna say hang something, hang, and you're just making sounds on that. This one has less obstruction at the physical or at the visual level. The obstruction is in the mouth itself because the tongue and the soft palate are closed down to create this sound. That is an easier sound for some people to make. So go ahead and try that out for your 15 seconds. And again, see how you like it. All right, I would actually like to hear back from Dr. Holmes Davis and Tori and see if you found one to be you really liked it, or if you found one that you actually couldn't do, or one that you didn't like.
I tried them all.
Hmm.
I feel like I had the most trouble with the spaceship
Hmm.
because I was puffing out my cheeks, but it didn't feel that much different from a regular hum.
Mm-hmm.
So I
You
was like, am I doing something wrong? And so that was the one thing.
never wrong. When you do that, and you can try it with your sound off. Can you try to do a lip buzz, but don't let the lips buzz? So instead of just do. And then with that sound, see if you can actually allow the breath pressure to build up in your mouth while still keeping that focused sound, and see if that helps, and report back whether with a yes or a no.
I think I'll keep practicing it.
That's okay. Absolutely. And again, there's some that are really successful for some and some that are less successful for those, and that's okay. You're finding the one that works best for you.
I liked the ng one because it allows me to open at the back.
Yes. The thing I love the NG too because it allows that opening in the back and there's nothing obstructing my mouth. I actually don't love lip buzzes as my own thing. Everyone does them and I love that. For me, it's actually too much pressure built up, which is the whole point of the SOVT is we're building up this back pressure onto the folds. We're partially obstructing, and I'm turning this way, we're partially obstructing this part of our vocal mechanism for various reasons and at different levels. But the reason why is we're actually creating back pressure of air to the folds, which then pushes them into a properly aligned position. The lip buzzes for me are too much muscular engagement up here, and it's a little too much pressure. I find that my tenors and baritones voices, they often don't love lip buzzes, which is why I came up with the spaceship or the pufferfish or the blowfish. Um, it does the same thing, but with less pressure, if that makes
Yeah.
sense.
As a band director, I think the lip buzzes make a lot of sense because we do that with our brass players.
Yes, absolutely. It's the easiest to connect to. Actually, I'm teaching a trumpet player right now, and I was like, let's just do a lip buzz because I know that's an easy one. The difference is for him, I actually had to get him to loosen his lips
Yes,
instead of the
especially, yeah, the high buzz, yeah.
so I had to go think tuba instead, and that really helped him.
Yeah.
The first one is straw phonation, and I y'all can't demonstrate it unless you do have a straw sitting around, and feel free. But the idea is you take a drinking straw. Mine is just a regular one. I buy a giant pack from Walmart, and I have them for students all year. The idea of straw phonation is you're making sound at the tip of the straw, and you're doing, again, these exercises or non-destination things. So let me demonstrate. That's non-destination, or making up melodies or octaves, things like that, right? Again, it doesn't have to be specific exercises, just something. What I like about straw phonation is it extends our vocal tract so that the sound is living out of us in a way. We're still obstructing and the vibrations here. But it's a visual aid of the sound living in the room versus sound living in us. And that's at the cognitive level, the idea of resonance is that sound exists in the room and is amplified naturally through room and through our own resonance chambers and not being muscularly amplified within us. There are questions about straw phonation. One, the biggest one I ever get is, does the size of the straw matter? Because this is your normal drinking straw. If you think of like Chick-fil-A straws, those have a giant opening. If you think boba tea straws, if you drink boba, those are even bigger because they have to fit those boba pearls. Or there's the coffee stirrers, which are very, very tiny. The idea is, does the size of the straw matter? The easy answer is no, but I wouldn't go so big as the boba straws. They don't create enough of the back pressure to be as effective as like Chick-fil-A, McDonald's, regular normal straw that you would get at Walmart or the coffee stirrers. Just truly, that's you find the one that works for you. I've done this presentation in person before, and I gave them this size straw, and I also gave them coffee stirrers. We tried out all of them, and there's always at least one person who likes the coffee stirrer, and it builds up a lot of back pressure. So you kind of feel like sound is going nowhere. Um, and some people really like that. Again, there's no right or wrong. Everything is very individualized. Have either one of y'all tried the straw phonation before?
Yes, I have.
How did you?
One thing I notice is in the lower range, you feel more vibration, and then as you get higher, the you don't feel that vibration anymore. And I guess that's right. That's how it should be.
Yeah.
Okay.
Yes.
I haven't done it for this, but a lot of brass players I know will take a big, like, piece of PVC and
Mm.
they blow through it. They call it an OHO tube, and the point of it is actually to eliminate pressure. So
Oh.
that when you breathe in, you breathe in oh, and you breathe out ho, and it relaxes the throat. So they do a bigger one for exactly the opposite purpose.
Gotcha. Yeah, that is wonderful. Thank you for telling me that. I had no idea. Yeah, the whole purpose of straw phonation or all the other SOVTs is actually for the pressure, and it's not, and I should clarify, we don't want pressure, we don't want to feel the pressure all day when we're talking or singing or any of the other activities that require our voice. But we want the pressure in this particular warm up so that it actually properly aligns your vocal folds. Because what I actually noticed is both of your speaking voices are sitting in a much more easily resonant position just after doing the few exercises for the 15 seconds each. Suddenly I'm like, oh, there's a natural resonance in it, and it is so that's kind of a testament to how quickly these can be effective. And you don't need to spend 30 minutes warming up. That's a little excessive. And what teacher has 30 minutes to themselves? None that I've ever known. But you probably have 2 to 5 minutes, either walking between classes or but in the transition time between classes. And that is plenty of time to get this kind of warm up in, which is the whole point of this. And Tori, to answer what you kind of said about when you've done straw phonation, and probably all SOVTs, I'm assuming that in the low you feel a lot of vibration and it's really pretty prominent. And the higher you get, it probably thins out the vibration. That's actually the formants working with you at that moment. A lot of singers will report the higher they feel, it feels thin, like it's a thinner sensation. That is very, very normal. And so we actually want to embrace that through these exercises. So the other thing I want to talk about with these exercises is there's no right or wrong to how high you take them or how low you take them. Again, it's all comfort based. I even before this presentation, I warmed up using some of mine, and I think I covered an octave and a fourth, and that's generally about how far I take mine. I don't like to go super high as a tenor baritone. It's just as a physiological thing, it's harder for us to take some of the thinness up because that's not necessarily how our voice operates. But I can, for a soprano or a mezzo or an alto, absolutely. You do as far range as you want. And there is no time limit either. However much time you have and you want to commit, great. But I would do them every day. I think you'll find a lot of success in your own voice and the time in which you have to keep your voice at its optimal level. Those are some exercises I think would be great for the voice. Now, what I also wanted to talk about is some of the common myths about our voice that I hear quite a bit as a voice teacher. And so the first thing I hear, and I think every teacher would kill me if I ever said the opposite of this, is that I hear, oh, I shouldn't drink coffee or I shouldn't drink caffeine. It's bad for the voice. The answer is it's not, actually. Studies show that a moderate caffeine intake, just don't drink coffee as your only source of liquid during the day, but I mean, you do what you want to do. As long as that's balanced with actual water, you're fine. Caffeine does dry out the vocal folds. The vocal folds are actually covered in mucus, which I know it's probably not the greatest topic, but they are. They're covered in a nice slippery mucus to keep them easily flowing. It's kind of like oil in a car. It's when the oil gets bad or the mucus gets sticky that's when it starts to cause problems, and that's just a lack of hydration. Coffee will create the bad oil or the bad mucus, but as long as you counteract that with water, it's completely fine. So drink your coffee. Please drink your coffee. We all want our coffee. Caffeine is not bad for you. The other one I hear all the time is dairy is bad for you. Cheese, can't drink cheese, or you can't eat cheese, or you can't drink milk, or you can't have ice cream. The answer is no. That's a lie. It's really how your body reacts to dairy. Some people are I think there's like studies that show that adults, the older we get, the more lactose intolerant we become, and some are extra lactose intolerant than others. Um, but really, it's just your body's reaction to the dairy. That's the big thing. Um, and the last one I hear often is whispering can save my voice, or whispering is so much better. Actually, whispering is pretty bad for your voice. It causes your vocal folds to sit in a very like rigid and tense position. They're quite stretched and they're not able to wave because what you're ended up using of your vocal folds is a very thin part. And that thin part is actually what we use for high pitches, but you're only letting them stay in a very rigid, thin part. What you're wanting to do with the voice is keep it waving. So whispering, if you need to whisper, it's honestly better just to be on complete vocal rest. So I have a lot of teacher friends who struggle with laryngitis quite often. They'll get that in their life. Don't try not to whisper through it. You find nonverbal ways to communicate with your classes. It's not that whispering is going to cause damage. It's just not going to treat you the way that you think it'll treat you. So I, as a voice teacher, would tell somebody, just go on vocal rest for a day and and take care of your voice and you'll find it's better. Have either of y'all heard any of these three vocal myths before? That, oh, you shouldn't drink caffeine or don't have dairy or whispering is better?
I've definitely heard the caffeine and the dairy.
Mm-hmm.
Yes, I've heard that too.
Yeah, for me, dairy, like a personal, again, these are all, the voice is so personal. It's your body, right? It's not, it's not like a mouthpiece if I just get a new mouthpiece. Unfortunately, if your body's not feeling good that day, your voice is not going to feel good, no matter how many exercises you do. So for me, my personal voice, my personal body, dairy doesn't do a thing to me. It gives me heartburn, and that's what causes an issue with my voice. But some people say the dairy it makes you phlegmy, and for me, dairy does not do that. But I know plenty of people it does. They avoid it like the plague. For me, for instance, if I'm having to perform a day or speak for a long time, I avoid spicy food. Spicy food immediately gives me acid reflux, and that causes a hoarseness to the folds because it's stripping the mucus away again. So they're waving, but that's a very, very dry wave. I can't do spicy food, for instance, and that is something I have to do to take care of my own voice. Some considerations that we should have for our own voices. Just stay hydrated. There does come a point when it's a little too much hydration in your life. So just be mindful about how much hydration means to you. There's various tests that you can do to see if you're properly hydrated. But if you're going to drink caffeine, maybe do a cup of coffee, then is balanced by a cup of water. A cup of tea is balanced by a cup of water. Just always try to stay hydrated. Avoid excessive coughing or clearing of your throat, which is so hard to do, especially in pollen season right now. Coughing, actually, if your folds are trying to wave, coughing slams them together. And it's a surefire way to just weaken your voice over the course of the day. And then clearing your throat is another. It causes the folds to slam together a little bit. So I don't know if anybody listening to this or my two on the call are like when they do this, if you've ever felt after coughing or clearing your throat, you actually feel hoarser or like it's more effort to talk afterwards. Have either of you felt it before? It's a pretty common thing with the coughing and the and clearing of the throat.
Especially during pollen season.
Oh my gosh. Pollen season, don't we love? We love Georgia for so many reasons. Pollen potentially is not one of them. The other consideration is, as Dr. Holmes Davis mentioned, use a microphone. Microphones are relatively inexpensive. You can get and it's a portable one, so the amp ties. You can get like a Bluetooth mic with a Bluetooth amp, and that would I think would be great for like bands, band directors and orchestra directors. But also you can find one that has like a portable amp like that you just clip to your waistline or something. And those are relatively inexpensive. And often, if you talk to your principal about it or someone at your school, they'll buy it for you, because they're not very expensive. And the other thing too is that you could mention it that it's health related because it is. At the end of the day, it's a health related to teach your best, which is a good proper justification to get a microphone. The other thing, especially for my band directors and my orchestra directors who have never taken a voice lesson, and even for my choral directors who have, it's been a while since a voice lesson, try a voice lesson and tell them I'm an educator and it's not that I'm wanting to sing better, it's I'm wanting to learn how to use my voice. When I'm teaching students and when I'm doing my own exercises of the day, it's not honestly, I spend 25% of my week telling my students, "Can you make sure that you're speaking properly?" Half the time I'm just asking them to speak in a more efficient, resonance-driven effortless way versus what I'm sometimes hearing from my students. That's really all we're doing in a voice lesson. We're teaching everybody this is how I breathe, which is this proper low abdominal rib cage expansion, expansive breath, and that you're using that breath to then talk. Truly, that's it. And the other thing we should consider is nonverbal ways to get the attention of our students. Raising our voices, one, can heighten stress in our students, research shows, but two, you're causing wear and tear of your own voice. And for what cause? So nonverbal ways to get their attention is always great. For Tori and Dr. Holmes Davis, what are some nonverbal ways that y'all have used in your own classrooms to get attention of your students?
Um, Ways that come to me
Mhm.
is just like the, regular clap, call and response clap.
Yep.
And so that's a good one. Or raising a hand or finger and they all follow suit is a great way because everyone will stop and do what everyone else is doing and you don't have to say anything.
I've used both of those, the rhythm clapping and then also the raising of the hand. And basically in education, it doesn't matter what you do as long as you teach it and practice it and the students understand the expectation, then whatever you do. I worked for a band director for a marching band season, and he would do the little Muppets thing. He'd get up there and go, mana, mana, and his band would turn around and go, doo, 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 doo. And that's the way he got their attention. My husband had a huge marching band, 250, 300 people, and he'd just walk out there and go, hey, band, and they'd turn around and say, hey, what? And,
Hmm.
those are not nonverbal, but, it's not like he's trying to yell over 250 people.
Yes, exactly. I've visited, I've been in the choral classroom. I've also visited a lot of choral directors. Um, the frequent one I see is the one that both Tori and Dr. Holmes Davis mentioned, which, and this is often the rhythm that starts is the, and then everybody repeats, and it's great. And again, it's a nonverbal way. You're saving yourself having to try to talk over people when that shouldn't be the case. Hands up is great. I've seen there's one about, and I don't know this one as well, about the bubble, catch a bubble in your mouth. Um, and then some people do I've seen some people turn lights off before and they turn lights off and lights back on. That you could possibly use. I think I would be mindful about it, particularly if I have students who suffer from epilepsy. That could possibly be triggering for them. I also have tried this with students before, where, and this again, this is not nonverbal, like we mentioned, the having a call and response, a verbal call and response. But something I do is if the energy level in my classroom is high and my students are talking and they're getting really excited, I start talking, but I keep it a pretty mellow tone and I keep it my normal speaking level. I don't go soft, I don't go loud, I keep it my normal speaking level. and they just start talking. Eventually, and I keep going with the lesson. The students then start to quiet down a little bit, or the other student gets their attention, or something like that happens if you really need a verbal way to communicate. I've also seen like a poster on a board, and just a poster of, it could be anything. It could be a funny cartoon. It could be somebody putting the hand over the mouth, and they just point and they wait. I know I'll have college students who come in and they're like, "Oh, my teacher always did the I'll wait." And they always tell me how much they don't necessarily, they like roll their eyes and they'll smile and they're like, "Yeah, it was so annoying." But what you're doing, I mean, it can be, I guess, annoying, but you're saving your voice. There's no reason to talk over students. Um, you can find, I want to challenge you, if you don't already do it, find the nonverbal ways to get the attention of your students. You only get one voice. We need to take care of it the most we can. And so the things that we need to do, and this is the link that I have on the PowerPoint is you, and I can send this PowerPoint out if y'all would like, is it's just more things on which to take care of your voice. But the main takeaways of this are: warm up your voice before your day begins. And you can use straw phonation we talked about. You can do lip buzzes. You can do raspberries. You can do the spaceship. You can do the NG. Another one that we didn't talk about was rolling your R's. I find students and other people can't always roll their R's effectively. So do that one if you want, but is another way to do SOVTE. Start your day with that, 2 to 5 minutes. Find any, you can do them anywhere. As a singer and as a traveling singer, I often have to be in a hotel and I need to warm up because I have a rehearsal at 9 o'clock in the morning. And I take my straw and I just do some straw phonation exercises. I also will sing in a towel. That's not an SOVTE and it's not easy to do, but that helps. And I'll often do the spaceship sound because I find the spaceship is a lot more muted than the lip buzz and whatnot. So truly, these can be done anywhere. I would, if I was still teaching in various periods, I would probably do a short SOVT exercise between each period just to reset my voice, right? And then after I'm done teaching the large haul of teaching for the day, I would do a cool down exercise. And the cool down exercise is truly, you just do the exercises again. I would focus though, when you do those exercises, coming down. So instead of a brrrr, I would probably do a brrrr, a sigh down. And that just can help this feel nice and relaxed again. And again, 2 to 5 minutes. It's not like you need an excessive cool down routine. Just enough to keep the voice moving throughout the day. So those are the three things that you should think about with that. And then figure out what your body likes. Can your body handle a lot of caffeine vocally? If you can't, don't drink a bunch of it or drink more water. Try to not have dairy or things that can cause the voice to activate itself in a negative way. Request a microphone. If you've tried all these things and you're like, my voice is still hurting at the end of the day, or I still catch myself trying to yell or trying to talk with a lot of force, just get a microphone. At the end of the day, just ask your school to purchase a microphone for you. Um, we don't need to use our voices in such an extreme measure. And then find nonverbal ways to communicate with your students. Another thing that I've actually done with students is I've tasked a student, I'll tell a student like, "Hey, can you go get their attention?" Students love to be in charge. So it puts the onus back on them and they'll get people's attention as well. And again, you're not having to raise your voice for it. And this idea was the idea of this conversation was, I was thinking about my marching band director friends, and particularly any of my director friends who have brass in their ensembles. It could be so hard, and I empathize so much. And so I want to really encourage, particularly during marching band season, always have a microphone on the field with you. Always, always, always. It will just really take care of your voice in a beautiful way. My last slide is just my references that I found, and these are some articles, and I'll leave it up here for just a moment if in case you're curious to look up more of these things, and look them up for yourself or any of these people. These are great ways to take care of your voice. And I also want to encourage you rest when you need to, which is so important for teachers, is if you do feel like your voice is not cooperating the way it is, two things you can do. The biggest, just rest or go to voice therapy. And there's nothing wrong with voice therapy. I've been to it myself as a singer, which feels very taboo. And it was great. They really helped give me exercises to recenter my voice. So that's it for my presentation currently. I just wanted to open it up for any questions that anybody may have before we end today.
Do you find that these same things help whenever we're sick? Because, like you said, our body is our instrument.
Yeah. When you're sick, absolutely. When I'm sick, I still do these same exercises. And again, too, it's because if we go back to the idea of working out, these are muscles. So we do need to keep them active in a way. Um, if you're if you are complete, like there is no sound coming out, don't force it. No point in doing the exercise. That is when complete vocal rest is great. If you're just having drainage because pollen is out and the voice is a little scratchy, I would still do gentle SOVTEs just to keep the voice active. When I'm sick, I'm more mindful about not taking something too high, to be honest. Often my high is what's impacted when I'm sick, so I just keep things in a very comfortable range. But that's all I need, really and Julie. So even when you're sick, highly encourage you to do this.
All right, I had another question, but it jumped away, so give me a second.
That's okay. I actually wanted to bring something. I mentioned don't cough or clear your throat since we're talking about being sick. And so then people are going to be like, well, what am I supposed to do? If you really need to cough, cough, because that is your body's way of trying to get rid of things out of your lungs, anything that's settling. I find if you truly need to clear your throat, do two things first to see if they work. One, just do a simple swallow. Often it's because we want to clear our throats when there's like an irritation along in the trachea somewhere. And at the vocal fold level, it could be just a substance that it just trickled down. Often swallowing will cause the muscles to loosen it and make it fall. The other thing that you could do is hum, just a gentle hmm. It'll make your folds vibrate and also loosen gently whatever may be on there if it's at that level. Um, if it's lower than that, that's a very different story. I would just cough or leave it alone.
Okay, my question was I talk with muscle quite a bit, so I can feel that, my throat gets tight and my folds get tired throughout the day. So in
Hmm.
addition to the exercises we talked about, do you find that that's an air issue? Maybe we're not using enough air to support what we're doing.
Yeah, and particularly in America, there's studies that show it's an air issue that we're not allowing the airflow to go through. So when I talk, which I don't always have the best speaking voice myself, I try very hard to find a proper resonance. But when I'm talking, the amount of air that I'm thinking is the amount that I would want to sigh with. So this, oh, just a gentle sigh. Oh. And if I think of that as my airflow, then generally I find that's the proper amount of air that I need. The other thing that we find through research on American speakers is it's our pitch level. So, in particular, we find with those that identify as female, we find that their pitch level is often lower for various reasons. It's just sits a little too low. And so we often have to find a slightly higher pitch level. So what you can do for this is if you'll make the sound in which you agree with somebody, which is mm-hmm, at whatever pitch level works for you, and you want to feel very neutral about it, mm-hmm, that is about your pitch. That's your optimal speaking pitch. What we find for those who identify as a soprano, mezzo, or alto, or identify as female, most of them go, "Oh my, that's way too high." And it's like, unfortunately, yeah, we all speak just a touch too low. I don't find this as often with tenors and basses or those who identify as male, but I do find it in the reverse. And so we just have to find a little bit of a higher speaking pitch and it's not that you want to be monotone, it's that you want to linger around that window more often, and then just a proper airflow, a gentle airflow.
We teach the pitch issue to new teachers to try to project the back of the room because
Mm-hmm.
the higher pitch projects better, but I hadn't thought of it just in terms of general speaking.
Mm-hmm. Yes, absolutely. And we should use it in our general speaking. And I think that when I talk about this with people, when they change when they think about the new pitch of their speaking voice, it can sometimes cause like an identity crisis. They're like, oh my gosh, people are going to think I'm now weird because I'm speaking so high. And it's like, they'll get over it in a week. I
They probably
promise.
won't notice. Yeah.
Either correct, they'll probably won't even notice, or they'll just be like, okay, that's your speaking voice. Got it.
Yeah. It's like when you get a haircut and people take 3 weeks to notice.
Yes,
Tor
exactly.
Sorry, Tori, did you have any questions?
I can't think of any other questions now, but all of this is really good for me to think about, moving forward.
Yeah. And some just reminders for all of us too. Every time I give this presentation, I always go, oh my gosh, let me make sure I'm warmed up and let me make sure I've done the things I'm supposed to do. And I do this literally almost 24/7. I'm always mindful about my voice because it's what I do. Um, we all just need this little reminder here and there and to debunk some of the myths about the voice and also give us tools to better our own voice, to keep it at a healthy level for our careers.
Yes. All right. Thank you, Dr. Sowell. This has been wonderful. My husband's been puttering around in the back and kind of every now and then he'll stop and raise his eyebrows so thank
Right.
you. It's very important. I talk to my elementary teachers about their voice, things like sing for them, not with them. But
Mhm.
aside from that, I really leave my choral people to their vocal teachers and what have you. So it's very good for me to know. But
Yeah,
thank you so much for a wonderful presentation. I will let you know when we put it up in the archive so that you can put it in your curriculum vitae.
sounds good. Thank you so much. It was a pleasure to talk with y'all.
All right, have a great Saturday.
You too.
Bye bye.
Thank you.
Thank you. Bye.